Okay, well, we're talking about blepharoplasty. Blepharoplasty is a medical term that means an operation on your eyelid, and it could be your upper eyelid or your lower eyelid or both. Now, obviously, the difficulties that we may present with the eyelids are rather different, whether it's uppers or lowers. There's a lot of commonality there because the issues really relate to two things. One is prolapse or bulging of fat, which tends to be more noticeable in the lower eyelid but can occur in the upper eyelid. And the other thing is the redundant or excess skin, and that tends to be more noticeable in the upper eyelid, but it's also noticeable in the lower eyelid. So the operation primarily is to reduce the amount of skin redundancy, to tighten up the ligamentous structure around the eye, and if need be, to remove the bulging fat elements to improve the contour of the tissues. Now, in the upper eyelid, when you're trying to assess a patient for blepharoplasty, you've got to look at the brow, you've got to look at the eyebrow position, and it may be that part of their problem with the eyelid really is because their brow has come down. And so in some patients, even though they may be presenting for blepharoplasty, they may need a brow lift, or they could indeed need both of those things being done. One of the things that's really important with upper lid blepharoplasty is to make sure that the patient's still able to close their eyes. If you take too much skin out, then the patient's not going to be able to close their eyes properly, and we haven't done them a service at all. Now, it's important to explain this to the patient because sometimes after the surgery, the patient will be very happy, but they'll say something like, "Oh, gee, doc, there's a tiny little bit here. Can't you get that extra bit out as well?" Well, of course, remember we talked about that because that little bit is the bit that allows you to close your eyes. And so again, it comes back to realistic expectation of what we were talking about before. In lower eyelid surgery, again, it's a skin tightening, a ligament tightening, and removal of fat as might be required. But the prime difficulty with lower eyelids is that if the tension in the lower eyelids is too great, again by taking out too much skin, then the eye bows downwards like this. And again, that's a very poor cosmetic outcome, but also it provides a functional problem as well, and the eye becomes watery and teary. Now, those risks are inherent with any eyelid surgery, and so it's very important to try and make sure you minimise those risks and to avoid that sort of circumstance. So you do have to be careful about it. Again, it points up the issue that we're not just talking about a beauty thing. We're not just talking about a cosmetic appearance. We're actually talking about a proper surgical procedure that's very delicate and very complex, and it has to be approached with the right mindset. And that's such an important thing. Now, sometimes patients might not be ready for a blepharoplasty. So what else could we use? Well, laser resurfacing might tighten up the skin that's not too severe, not yet ready for surgery. Laser tightening might help with that. In the lower eyelid particularly, the eye trough that we often see in patients, that can be filled with a filler, and sometimes a slight bulging of the lower eyelid combined with an eye trough. Well, if you put the filler into the eye trough, you disguise the bulging of the lower eyelid. So there are actually non-surgical alternatives as well. Blepharoplasty, particularly upper lid blepharoplasty, is one of the more common things that we do. Once we get past a certain age, almost all of us have a problem with our upper eyelids. Sometimes the eyelid's redundancy can be so bad that it's obscuring your vision, and that hooded effect stops you seeing things out in here, and that presents a real problem for people when they're driving cars or when their peripheral vision is important, like in a factory or something like that. And so in those circumstances, you can actually claim a Medicare rebate for the procedure. Now, in a much younger person who doesn't have those elements but still wants to freshen up their eyes, unfortunately there's no Medicare rebate for that. But that's as it should be, because in that circumstance we are talking just about a cosmetic appearance rather than a functional deficit that we see with the obscuring of vision.